everybody. Welcome to this month's NAVRO MedTech Career Spotlight webinar. This is part of our MedTech Unplugged webinar series, where our mission is really to connect motivated candidates, whether you are students, recent graduates, or even seasoned professionals, with life-changing opportunities in the medical technology industry. If you've been with us previously, you'll know that throughout this webinar series, we aim to provide you direct insight into really what it takes to break into and thrive in this fast-moving, high-impact field. Today, I am thrilled to welcome Jeremy Leeper. He is a regional sales director at Abbott in Abbott's Cardiac Rhythm Management division. And with a proven track record in leadership, as well as building high-performance teams, Jeremy brings a deep understanding of what it takes to succeed in really one of the most competitive sectors in medtech today. Today, we're going to dive deep into what hiring managers are really looking for. So whether that's positioning yourself as a standout candidate, avoiding common pitfalls in the interview process, we have all been there, or just simply preparing yourself for a role in med device sales or another opportunity in medtech and beyond. So whether you are actively applying, whether you're just exploring your next step, or even here just to learn some more, this is your chance to hear it straight from someone who makes hiring decisions every single day in medtech. So I'm going to ask that you keep your lines all muted for right now. I'm sure as we go through our conversation, you will have questions that pop up. And at the end, we'll definitely try to get to those, all of your questions. I highly encourage you to step forward and ask those questions if you have them, because here's your opportunity where you're not in an actual interview, but to get those questions answered. So let's get started. So Jeremy, where do we actually find you today?
I am not at a Jimmy Buffett concert, but as part of my roles here for Abbott CRM, I cover Los Angeles and the great state of Hawaii. So you've actually caught me over here in Hawaii. If you see me looking in this direction here, it's basically a view of the beach. Hopefully that comes in. Maybe it's a little blurry with the background filter there.
I can certainly envision it.
Yeah, close your eyes, get a drink in your hand for those of you that can, and happy to go through and thank you for the opportunity to be on your series today.
Well, I'm having a little hard time imagining you doing a lot of difficult, life-changing work over there, but I know that you actually are. So tell us a little bit, aside from enjoying the gorgeous view, tell us a little bit about what your current role at Abbott is and what your team focuses on within cardiac rhythm management.
Sure. And first, let me just kind of jump off and say that, I'm very privileged to work here at Abbott. It's a great company. It's a great opportunity. But anything that I share with you guys is nothing proprietary. There's no secret files or anything that I'm kind of pulling from. This is really kind of cobbled together over almost 20 years of experience within CRM sales. But cardiac rhythm management, for those of you that don't know, we deal with conduction system issues within the heart, whether it's slow heartbeat, fast heartbeats. We are there to provide life-saving devices for these patients, life-saving therapies. So our goal is to earn that business, implant that patient with one of our devices, program that device for the best patient outcomes, and then follow up with that patient throughout the life, basically, of their device. So it's a very fast pace, very high demand. It's a thrilling job, but it's also not for the faint of heart. So, and I hope that is something too that we can kind of, maybe touch on a little bit today with some of your people, is really making sure that they are, when they're interviewing or applying for jobs, truly understanding what it is that they're kind of getting themselves into, because there's a lot of different ways to get into med tech.
Yeah, that's for sure. And the folks that are on your team, it sounds like their day-to-day could be at times exciting, at times terrifying, certainly never boring and mundane. How many folks do you have on your team, and what is it, if you can even describe it, what does a day in the life look like?
So we have 31 on the team. I have territory managers, I've got sales reps, I've got clinicals, I've got product specialists. And the day starts off, usually you find out the night before what it is that you'll be doing the next day because the schedule's kind of set. And then from there, you just hope that it goes as planned, really, because things add on, things cancel. There's an emergency or somebody's perception of what an emergency is. It's very difficult to kind of predict what the day is. So I think the ability, if you're somebody that is structured, which, not to generalize, but most engineers like that structure, this can be something that's really difficult for people to kind of grasp. Maybe you want something that's a little less spicy than what this is. So if you happen to be engineering background that really likes to get out there and have a little bit of a different day to day, this is going to be something that you're really going to thrive in. So you can be in any sort of situation throughout the day. And I think that's the one thing that I've hired people that have been from the lab, the cath lab, let's say. This turned out to not be their cup of tea. As much as they hated being in the lab, they hated worse the unpredictability of what was going on with this job.
Mm.
So your day can be in implants, it can be in follow-ups in physicians' offices, it can be in the emergency department, it can be in the MRI suite, and all of that can just, as I said, start out one way and end up a completely different way.
I can imagine. How do you even begin to start sourcing candidates? We've got social media. I'm sure you have access through resources at Abbott. What does that initial search look like as you're trying to find, that needle in a haystack that's going to be a good fit for your team?
Yeah, great question. And I would say, this is the one piece that I would get into that I don't think there's anything proprietary about this, but as the people on the call, anybody that's applying, there's an open position. That's usually how they see it, whether it's on LinkedIn or the website, and they'll go ahead and apply. At that point, their information is going to one of our talent recruiters. And our talent recruiters go through and they start to identify what is the initial ask of this job. If the application that you're applying for is, let's say, a senior or a principal clinical, unless you've got experience, you don't qualify for that job. So
Mm,
you could very well get weeded out before you even, before it even comes to me, right?
mm.
So after, a week or so, I get a download of information of resumes that are sent to me. Some of them may have been screened if I've asked them to screen them or not. And they're going through to see, do you have any previous experience that allows you to be considered for this position? So if you see something that's a clinical position, or an associate clinical is what we call it at Abbott, where you don't have any previous experience, that's going to be something that they will not weed you out for not having experience, right? So hopefully that made sense. But then it comes to me and I'm kind of sourcing through there. I have my territory managers that are hiring for their own teams because I don't believe in an arranged marriage. I don't want to hire Jenny for, my coworker and I've never met Jenny. Why are you putting this person on my team, right?
Right.
Because you as a clinical are going to interact more with that rep or that territory manager than you're going to interact with myself. So that's a very important dynamic, is just that ability to integrate into a team. So the territory manager or myself will kind of sit down and weed through this. I prefer my territory managers to be the first person to kind of take a pass at these people. And I'm really just deciding whether or not it's a thumbs up or a thumbs down, are there any sort of red flags? But because they get busy, there are times where I kind of step in and I'm that first line of screening people through and say, hey, I think this person has what it takes, or this person, probably wouldn't be a good fit.
Yeah, and it's interesting because you mentioned, your territory managers having a first pass, importance of that team building and relationship. And really, there's so many different roles that these student candidates or even recent graduates or even seasoned professionals would be ideal for.
Yeah.
One thing I recall early on in my journey in MedTech, and it's only just gotten so much more complicated today, is really understanding, how do I even find the roles that I'm qualified for? The titles are varied. They're often very generic. And I'll be honest, sometimes the descriptions read like stereo instructions. So how can these candidates really kind of do a little research and find the roles that they might even be applicable for?
Yeah, that's a great question. You know, I started in pharmaceuticals, trying to
I
break
did
into
as well.
pharmaceuticals. Yeah. years and years ago, right? And I'm almost embarrassed to say that we were on sites like Medzilla. I mean, it used to be, those things that there weren't even really, the dedicated websites. Medzilla was kind of the space for it, but I think that the tools that are available now are there's so many, and the ability for people that are tuning into these series or checking out your site is the ability to use all of the tools that are there. Um, I've had a lot of people that have made it to me that said, I'm like, how did you get here? And they said, well, I connected with so and so on LinkedIn, and I was able to ask them a few questions, and they kind of directed me towards you. I think that if you are applying for, I'm going to use our companies because that's what I'm familiar with. But if you're looking at a senior clinical position and you're wondering, do I qualify for this? Go on to LinkedIn and type in Abbott Senior Clinical CRM and see what the background is of that person that's there. Most often now you will see, hey, they might have started as a clinical specialist and were promoted to a senior clinical. And so you go, okay, well, they've got some experience in this. And how long was it for them to be able to apply for what this is? I know for us, it's 3 years to go from a clinical to a senior clinical minimum. And so you have to go, well, I don't have 3 years of experience, right? But then you maybe search through and say, okay, what was the position they had previously? Clinical
Mm.
specialist. Let me find other people that have clinical specialist roles. And then they kind of, can start to reverse engineer that process and get down to the level of where they're at and find out, do I, meet what this is? Another thing too is reach out to recruiters. It's their job to talk to people to bring in candidates. Try and get some of them to give you, little bits of information. They'll let you know if you can get a hold of one of them, whether or not you're applicable for this. Um, but I would say for myself that if I'm sourcing for jobs, and we've had some times where we go through a little bit of dry spells where we don't get the right candidates that we're looking for, especially if it's maybe a senior clinical. I would definitely, encourage people to have profiles on your platform with Navro because it's so specific in what it is that I'm looking for, right? Whenever I go to Home Depot or Lowe's or whatever the case may be, I am not the type of person that's going to browse. I go up and find somebody in, whatever color vest, and I'm like, where is this piece right here? Because I want them to tell me where it is. And that's exactly what you guys are doing is you're identifying those people that are subject matter experts in engineering that have the backgrounds that we're looking for, that have the desired, location preferences to be where we want to be, so that we know that we are going to be placing the right people in the right position. So I think it's great that you guys have this.
Thank you. And it's great to have you and these candidates as a part of it. The goal is to, help continue to make these wonderful marriages and introductions.
Absolutely.
So let's say you've got a handful of resumes in front of you and you're really kind of just at first pass. And I don't want to make this a resume dive because
Right.
we've gone through that, but what might be something that makes you say, yes, I want to have a discussion with this person live?
Yeah, and I will kind of tee up some of the things that we had talked about, like the intention of what this call is here, right? We're looking for something that's relatable to what it is that's going on. I firmly believe that every single person that is a BME, graduate or a degree, or you've got some sort of electrical or engineering, anything, as you all know, I am not, or let me just say that I am not, if you haven't figured that out yet. I am not an engineer, but I think if you have engineer in anywhere, you are qualified to be in some sort of medical device sales position, hands down, right? So congratulations, you guys have all gotten these degrees. Now, how are you going to stand out from every single person that has it?
Yeah.
So I feel like my experience and my strengths have been more to, shine with what I'm good at, which has always been the ability to connect with people. Maybe not so much on the technical side. So, specifically in my resume, I've got a bottom section that says fun facts about me, right?
I
My own
love that.
background, I was a, former Division I volleyball player. I feel like that's something that I'd be able to talk to somebody about goal setting and achievement, right? Especially if I'm focused on I want to be in sales. I've got a family, we have multiple dogs, we like to travel, we like to hike, I like to read, I'm passionate about my kids' sports, those types of things. I want to connect. I want to connect with somebody because I don't know DOS, I don't know MS, programming, whatever those things are. So the fact that you guys are proficient in that, thumbs up because I don't know it, right? We're not going to have a conversation about that. I want to know, can you relate to people? Can you do those things? So I'm looking for something that's a little bit of number one, an achievement, and number two, some sort of personal connection that I can make with you so that we can start to have a conversation. We'll get to the technical piece of this, and I know you guys are all aces at that.
Wonderful. Connection's so important.
It
Would
is.
you say that's one of, outside of that, what are the other maybe top 2 to 3 things that immediately stand out to you for candidates that are ideal candidates?
You know, I I believe it's funny. I was not an academic person. So academic performance is something that I look at and say, congratulations that you were able to achieve whatever you achieved, right?
Mhm.
I pound that into my children that they need to have opportunities based off of the work that they're able to do. And it speaks to your ability, your desire to achieve the best that you possibly can be. But don't be so heavy on that that you kind of lose sight of everything else. So I want some sort of achievement that's kind of popped up in there. I want to know what sort of clubs you were involved with, right? And my hope would be that it's something that's not just, you know, so focused on I was the head of the engineering club, or you know what I mean? Get
Yeah.
something a little bit outside of what it is that you do. I want a variety, right? I don't just want a single pillar of your achievements. So I'm looking for something in that regard, something volunteering, right? Giving of yourself to what's going on, because any any job that you get in medical device sales is going to be harder than you think it is.
Right.
If you're going to be on a team, how do you demonstrate that you are going to be a good teammate? Can you give of yourself in order to be able to achieve the goal that they're all looking for? Because if I'm a rep, if I'm a territory manager within Abbott and I'm trying to hire you, there's going to be days where you might put your feet on the floor and say, I could be doing something so much easier than what this is, right? But if you're willing to give of yourself into that team dynamic, you're going to be very valuable and your career is going to go very far.
Mm. That's encouraging because I think so often, and I know I was guilty of this when I was first trying to get into the industry, you feel you have this sort of you're behind right out of the gates because you don't have the experience in med tech. You haven't had the roles yet, and I certainly appreciate that many of the folks on the call today are in that exact position. But it's encouraging. It sounds like that's not required to stand out. You're looking for a lot of other things, and you're looking for that connection, and it sounds like you're looking for a drive and a purpose.
Absolutely. There's no one thing that's going to, let's say I do reach out to you. I see, Jenny's resume here on Navro, and I'm like, this looks like a great profile. And I reach out to Jenny. You answer the phone, the first words out of my mouth are not going to be congratulations, you're hired, right? It's going to be a long process. I'm going to send you in a couple different directions. There
Mhm.
may be, I've got a lot of things going on. And while sourcing is always important because it's the lifeblood of what we bring in, it's not the most important thing. I've got an upset customer. I've got, a contract that I'm trying to do. I've got a couple of probably HR issues that I'm dealing with already on the team, right? So there's a lot of things that are there. Persistence is key. And the reason I say that is I was in pharmaceutical sales for just about 6 years. I spent the last 2 years really trying to break into med device. Two
Mhm.
years, right? 2 years. I had a wife, I had a young baby, and I'm trying to make this kind of career, jump, just like some of the people that may be on this call are. It took me 2 years. So it's not going to be 1 month. Maybe it is, right? And your network is your net worth as far as who you know and how things like this happen. But that's going to get you a seat in front of, for us to be face to face. And what you do beyond there is really going to determine where you go. How that interview goes is going to determine it. Um, an interview is an opportunity to really kind of sell that person sitting across from you as to the why. So there's so many things that kind of lead up to that point, but it's also very important to be persistent. It's important to be, to know that this is going to be a little bit of a journey. So
It certainly is.
yeah, yeah, for sure.
Well, let's talk about, I'm going to ask you to kind of think back on, I'm sure you've conducted hundreds of interviews in your career, and I'm sure some stand out as exceptional, and those folks probably enjoyed a wonderful career on your team and with your company. I'm sure there's several that stood out as memorable for maybe not the best reason.
Correct. Absolutely.
And it happens to the best of us. I mean, my very first interview in pharmaceuticals was, a dumpster fire, and we don't need to go on into that, but I certainly learned from it. So, what's something that candidates consistently do wrong in the interview process that you see time and time again? Or maybe underestimate. I think
Yeah.
yeah,
And I've touched on it a little bit, but I think it's, you always want to play to your strengths, right? And if your strengths have always been your academic performance, you're going to say, hey, I'm going to get in and I'm going to be able to learn this. And you're going to sit down and you're going to start telling me, you're going to point to all of the accomplishments that you've done scholastically to do those things, because you should. It's a really tall pillar of who you are. But as I said, I want to know that there is more to you beyond what that is. And it's not to say that I don't have people on my team that are very, engineer minded, engineer focused, and that's kind of who they are. I need those people, right?
right.
I'm also looking for future sales reps. And typically sales reps don't always have just that, I'm only clinical and that's it. So as I said, I want to see that there's a little bit more depth to what it is. I'm going to sit down, and some of the questions I'm going to ask you is, tell me something about you. And I'm going to go back. I want to know, what were you like in high school, right? Do you have a big family? Are you an only child? Where are your parents at? Do you have friends here in this area? Like, what's going to sustain you when you're having those hard days at work? Because you're going to have them, right? So I want to know a little bit more about you. It's almost like a psychological profile, more than it is just a look at my resume, it's amazing, because it is. I've talked to people that are getting their MBA from top institutions, or not their MBA, but their master's degree in biomedical engineering. You could give me the answers to the test and I still wouldn't be able to pass that course, right? So I salute everybody that's done that, but I want to know how you are going to be as a person, because at a certain point, that's what's truly coming to save you as far as your ability to develop your career. It's not going to be all the things that you've done. Not always is it the most um, it's not always the smartest person that ends up getting promoted, right? Or the person that's the kind of the right fit for the job. It's sometimes more important who you know, right? And what you've done, and who you've reached out to, and who you've impressed along the way. As I tell my kids, in anything that you do, it's a test and you don't know it, right? So you never know what you're being kind of evaluated on. You might say, well, I'm really smart. I can do this. I can program a pacemaker. And I haven't even, started with your company. It's like, yes, but I'm looking for somebody that's looking to fit in on a team, because we've got a lot of really smart people already, right? So I'm looking for different things at different times. And I think some of these interviews that don't go as well is people are trying to just drive a certain point and not kind of reading the room.
That you make an excellent point there about just listening and being relatable and making that connection. And I think, and I've had this experience myself, oftentimes you go into an interview, and the generic question, which can be the kiss of death, is, so walk me through your resume. And, I've done it both ways. I've gone through bullet point, bullet point, bullet point, and I can see their eyes glazing over. I've also gone too brief and given, a 1 or 2 sentence answer and thought, well, that was underwhelming.
Yeah.
How does someone, and I'm not saying you asked that question, but how does someone give the summary of their resume in a way that's engaging to you, if they're posed that question, that's making that connection you're looking for, that's not too brief, that's not too detailed? What's the best way to handle that?
Yeah, I think a good way to do it, and it's, there's plenty of posts on social media and stuff about it, but it's talking about what you're currently doing, or what you're currently completing. If it's your degree, I'm finishing up my degree at, San Diego State, go Aztecs. I'm finishing up my degree at San Diego State, with a focus on whatever. I came from this particular area. So start where you're at, go backwards about what you've done, your history, and then go forward to what your future is. I'm really looking forward to something in this space here. I'm really passionate about cardiac rhythm management. I'm really passionate about electrophysiology, whatever the case may be. Like, why are you talking to me right now? Why did you apply for this job? You know, I don't want to hear that my parents said I needed to get a job and, here I sit, right? But I want to know that you've done a little bit about this. So where you're at, what you're currently finishing up, what you've done previously, and then what you're going forward. And I'm evaluating how you are going to present to our customers, right? You are going to be working for a sales rep, trying to help them make money. That sales rep is trying to help the region make money. The region's trying to help the company. So I'm evaluating how can you articulate that in a very succinct way, and how polished are you as kind of a public speaker?
Mm. And it touches on, sort of a vague area. I feel like we are in this world today. So many of our opportunities are, or our business transactions are remote. We're on phones. We're in different locations. I imagine the folks that are on your team are often in scrubs. It's a different world. How important is that first impression, that presentability to you? And I realize I'm asking a very specific question as its importance to you, but
Yes.
what is your read on that when a candidate first walks in through the door? What is important to you? What are you looking for?
Great question. And I think, there's a reason that these sayings exist. It's because they're true, right? You never get a second chance to make a first impression, those types of things. Um, I when I was in college and was trying to go out and get a job, I started to read a book on how to kind of be, social graces, if you will, right? Never been to any sort of finishing school or anything else. And one of the things that it said was always be overdressed, because even if you're overdressed, it looks like maybe you're going to something that's more important than what you've got going on. Right. So
Mm.
if you go to a party and you're dressed nice, people are like, wow, you're really dressed up. And, maybe you don't have anything. I'm going to an event later on. They're like, oh, okay. I believe that you may be sitting down with somebody in scrubs or somebody in a Hawaiian shirt, but if you look like this is important to you, I respect the fact that you took the effort to get that done, right? Um, I think also something is people, reach out to me on LinkedIn. If you see that I graduated college in the 90s, let's be honest, I'm probably going to be more of a boomer mentality than I am something else, right? If you look and see that someone just graduated a couple years ahead of you, it's safe to say that you might be kind of swimming in the same circles as far as, your diction, your style of dress, the music you listen to, those sorts of things. But I would always say that it's still better to err on the side of caution and be over prepared, overdressed, a couple of copies of your resume as opposed to underdressed or underprepared for what's going on, because you never know where that goes. Let's say you have a really good conversation with somebody that set up that meeting and they're just a couple years older and they quickly go, hey, you know what? My area vice president's here, actually, and they're going to be joining us here in just a second. I want you to meet them. Now you're underprepared for that occasion right there, right?
Mm.
So always be more prepared than what you think you need to be.
And it's a great point because it could result in an incredible opportunity that's a missed opportunity if you're not,
Absolutely.
always have your resume, be on time, find a good quiet place if you're there early. I mean, I had
Yeah.
one hiring manager tell me the best interview he ever conducted was the candidate called ahead of time to make sure he had directions to the location, was there 15 minutes early and reached out to him with, hey, what can I order you for a coffee?
Yeah.
Had a quiet place already marked out in the business establishment so they could have a productive conversation. Just made it easy, right? And it just reduced the tension and made it a lot more relaxed, I think, for that candidate. And the hiring manager was thrilled. It's like if this is how you are conducting yourself with me, I know I can comfortably rely on the fact that when you're interfacing with customers, with patients, with other people at corporate, you're going to be doing similar fashion, conducting yourself that way.
Absolutely. But two points on there. There's a saying, how you do one thing is how you do everything, right? So if if something you haven't accounted for traffic or those sorts of things, if you haven't made that calculation, chances are you're going to be the same way if I hire you on the team. You know what I
Mm.
mean? So if you show up kind of unprepared, you're probably going to roll into a case maybe unprepared, and that's not going to work so well. You talk about some of these things, and it brings up a story that for myself, when I was trying to get into medical device sales, there was a time where I had interviewed a couple times for a position with a medical device company, and it was the second time I was going to be interviewing for the exact same position. And
Mm.
I'm like sitting there, and I
That's
said,
tricky.
Yeah, I said, I know for a fact I'm going to get this, right? I know for a fact I'm going to get this. I know who this hiring manager is. We've got people in common. This is going to be amazing. The door opens up and the guy comes out and says, Jeremy, come on, you're with me. And I'm like, that is not who I expected to come out and get me.
Oh,
I had not prepared to meet that person, right?
yeah.
Preparing to meet somebody else. And my preparation was, we have already talked, you know a lot about me, we have people in common, those types of things. And I was thrown for a complete loop. So it was at a very early point, it was don't underestimate any opportunity. Don't underestimate anything that's going on. And I had prepared to talk to a specific person instead of prepared to really sell myself. Um,
Mm,
that was a little bit of a miss on my part.
caught you off guard.
Absolutely.
Did you land the position?
I'm sitting here. So
It was that one.
yeah,
Great.
yeah, yeah. So
Well, I know a big part of this industry that you're in this sector that you're in, it's so high tech, it's so scientific. You mentioned at the beginning that your team could be in clinical checks, they could be following up with a physician, they could be in a pacemaker implant, all of these different things. I imagine Abbott has a very extensive training program. And these candidates, many on the call, are coming with that. A lot of them do have a degree in biomedical engineering or some facet of engineering or science related.
yep,
If not, they've certainly got a very healthy desire to do whatever it takes to be successful in this field and learn what they don't know. But
yeah.
how important is it to you? I guess a better way to ask this is, how deep do you want the ideal candidate to have gone in their preparation to understand your division, your products? What should they just automatically know walking into an interview with you?
It's a great question. It's a really good question. I think I had somebody reach out to me the other day that said they were interested in a role with us. They were coming to me and they said that they were interested in Abbott cardiology. Um, Within Abbott, there is a cardiology division, there's a cardiac rhythm management division. There's two divisions. So now I'm confused on which division are you actually interested in. And I realize that it sounds kind of, maybe like I am a boomer in that sort of way. But I want to know, like, do you know who you're talking to? In
Mm,
the sense of, have you done your homework? Right. Um, and I'm not expecting people to know our entire product category, but there's a few landmark things that have come out recently for us that I would expect there to be an understanding of. There's videos online about pacemaker implants, different physicians that have put some on there, videos of them walking through what that looks like. I would like them to have at least seen that. I would have liked them to at least, if they source some of these courses online through Navro, are there ways to kind of find out what these procedures look like? Have they done a thorough investigation or a deep dive into the exact position they want and kind of what that does? I don't expect you to have all of the answers to it, but I at least expect there to be some sort of a respect of my time and what I've got going on, right?
yeah.
Maybe you will have reached out and if you're that interested, you'll network, right? Before I got a role in cardiac rhythm management, I went online to try and differentiate myself from others. And I found that there were CME credits that were given out from like the New Jersey State Nursing Society for EP, and you just go on and take a couple of these, courses, and they were pretty simple, but they gave me a decent understanding of electrophysiology. I took those courses and had a few CME credits in the state of New Jersey if I ever wanted to be a nurse prior to coming into this, but it was because I was passionate about it. And I'm going, what do I need to do in order to differentiate myself from others? But what's going to give me a little bit of a foundation above what's going on? Because I'm not looking for the smartest, right? I'm not looking for the most well spoken, but I'm looking for the smartest, well spoken, educated person that I can possibly find to do this. It's not, it's not I need a 10, it's I need a couple of fives, or I need a three, another three and twos and ones. You can tell I'm not a math major either, but I want some diversity in what's going on. It's not going to be any one thing that's going to land this for you, but it's going to be a lot of small things that add up. And certainly understanding the division and a little bit about the role you're going for is going to do a lot for you.
For sure.
Yeah. And I
Let's
think the other thing too about that is it also helps some people, and I'll be honest, if they come to me and they're talking to me about a job, I'm trying to talk them out of cardiac rhythm management. And there's a
How
reason,
come?
yeah, there's a reason for that, because this is not for the faint of heart. It
Mm.
it looks cool, and you see a couple of things on these medical shows where they throw out terms and phrases that that sound applicable, but they're not quite actually. But at the end of the day, everything fades. The lights go down, the trash starts blowing through the area, and it's you and a bag and a really heavy programmer. And I want to know if you're interested in this or if you're committed in this. So I'm going to try and talk you out of it. And there's been people that have said, hey, you know what? I appreciate you being so real with me. I'm out. And you know what I say? I'm glad we figured this out after a 1 hour conversation as opposed to 6 months, 9 months, a year into your career. I want you guys to be successful. I want you to find the best fit for what it is that you've got going on. But if you're potentially not willing to, in 6, 9 months, put up with a nighttime of call or a weekend of call, your social life is more important. If 3:30 on a Friday rose and your friends is where your heart is, go do it. There's plenty of jobs that you can get for this. So really understanding what it is that you're applying for, and kind of the thought of an iceberg and everything that kind of lies beneath it. This is a very exciting job. There's a lot of sacrifice that goes into it. So I want people to know up front what they're truly buying into so that they can be a willing buyer for a willing seller.
Yeah, you've got to have that why, because if you don't, and if it's not, strong enough to keep you going on the darkest days, it's a grueling place to be, to not have that internal why that's real passionate. I mean, how often do you interview candidates that don't know what their why is, or just don't have one?
More than I'd probably like to. Again, it just gets back to they're qualified. I interviewed a young man recently, who, on paper, I mean, everything was solid. Sat down with him, really engaging as well. And ultimately, he's like, "Look, I don't want to move, 10 miles across town. I'm in LA, right? I don't want
Mm.
to move miles across town." And I'm like, hey, I respect you for saying that right now, right? But I think that you kind of have to come up with your priorities. Um, what do you want? Are you in the career building stage right now? If that's where you're at, perfect, right? I got into this with already a family. There's been times where my wife has had to actually kind of scale me back a little bit and say, hey, listen, I know that this is important to you and I'm committed to this, but I kind of need you here a little more present than what you are, right?
Mm.
So you have to be willing to handle those things. If you're dating somebody, are they going to be offended that you're all of a sudden having to give of your time to go to training and learn? Because you're going to put in a lot, especially up front, to get proficient in anything that you do. And the training time for all these jobs is different than what it is. If you're not prepared, if you haven't had those conversations with the people that are important to you, that could be a little bit of a recipe for disaster down the line, where they're not happy, you're not happy. And I will say this: if things are not well in your personal life, they're not going to be well at work, and vice versa. If you're frustrated at work, you'll be frustrated at home. So, yeah, there's a lot of things that go into it. So really understanding what your why is, how you approach this job on a daily basis. You're going to get a break from it. You're going to have slower days than others. You got to remember those are, it's not always going to be bad, but we always, as human beings, tend to remember the worst as opposed to the best.
Yeah. I think, in thinking about a lot of what you're saying, and the fact that you have a team of, I think you said 31 people under you, it's nice to have, those peer-to-peer opportunities if you're having those difficult days, or you're trying to struggle through, or even celebrating your wins. We're focusing a lot on the challenges of the role, but there's a lot of exciting, wonderful, wins and rewards and great days that go along with it as well. And with that, I imagine there's a lot of working with counterparts, cross collaboration. Culture we know is a really important fit. So, how do you go about assessing if someone's going to be a good fit for the culture you've established for your team and really with Abbott's culture?
Yeah, great question and a very important topic. And the reason that's the reason I don't hire for, my territory managers, right?
Mm,
Because I want them to, they all have a superpower and I want them to bring somebody in that's going to complement that superpower, right? Um, the culture piece is so big. And again, if I spend the first time that I sit down with somebody trying to lay out for them what the role looks like on a good day, on a bad day, and kind of giving them a mix and tell them that they're only going to remember the bad days that are there,
it's so
right?
true.
I want them to kind of search their soul and really go, yes, this is going to be for me moving forward, right? It's almost like tell me what your worst day at work is in your current position, and let's kind of compare and see if this is going to be something that fits. I am looking for somebody that's going to be a good teammate. Um, I've got a pretty big family. I've got 4 kids, and I see the different personalities that are in each one of them. And nothing drives me crazier, right, than when I'm at the sink and I'm doing dishes, and there's a bunch of dishes that are there in the sink, and in their mind, they're like, I took care of it. I put it in the sink, right? It's like, well, you've got to get over into the dishwasher. Or when the girls finish emptying the dishwasher and they don't put the dishes that are in the sink into the dishwasher, and I ask them, why didn't you do that? They're like, well, it's not mine,
Oh,
right? Trying to instill in them that yes, it's not yours, but we all play a role in the development of where this house goes, right?
right.
It's the same thing at work. I boil it down to the simplest of things. Whatever your parents taught you, whatever your coaches taught you, whatever your Boy Scout, Girl Scout leader, religious leaders, whatever it is, whatever you've learned about being a good person along the way, a good human being, carry it with you, and realize that when you start out in medical devices, it's like you're not even really qualified to do more than carry coffee from point A to point B if something's going on, or go and pick up a lunch or do those things. And it sounds really menial, but you got to build your ability to handle the next hardest task, right? So you've got to
Mhm,
listen more than you speak, and you've got to be willing to put in extra and look for work beyond what they are just asking you to do, right?
mhm.
That's another thing that kind of drives me crazy, that people are like, hey, my day's done, I'm going home. You're part of a team. Reach out to that team leader, the other clinical, the person that's, you're going to ask one day to have your back. Hey, do you need some help with this? Let me help you with that, you know?
Yeah,
So if I'm sitting in an interview and somebody drops something, or there's somebody coming up that's having a hard time getting through the door, and I don't see you at least looking to kind of help that person, a little, signal's gone off in my head where I'm like, okay, you're not looking beyond just yourself, right? So it's something that's like a huge pet peeve for me. Again, everything is a test. You just don't know it.
that's such a great analogy for it. Let's
Yeah.
let's pretend we're towards the end of the interview and you say to me, "Okay, Jenny, I've enjoyed our conversation. What questions do you have for me?" And, I just go deer in headlights. What are you hoping I'm going to ask? What would be some good engaging, thought-provoking, intelligent questions that you're hoping your candidates are thinking about and going to ask you?
Yeah, great question. And I can tell when it's going, kind of deer in the headlights, and it's like, what questions do you have for me? Right? Because everybody likes to talk about themselves or what's important.
Yeah.
So I want to know, I would want a candidate to ask me, listen, I understand that I'm not going to be of much value there in the beginning. What have some people that have been extremely successful as new people within your organization? What are some of the behaviors, or what are some of the activities they've done to add as much value at an early point as they possibly can? And I
Mhm.
realize that one is maybe a little more top of mind because I just got done kind of talking about that. But I think you can even generalize it a little bit more and say, hey, who's the top, who is the top performer in this role that I'm about to enter into? What has been their track record of, success? What have they done that has made them as good as what they are, right? Who are some of the people within your organization that I can maybe talk to find out a little bit more about this? I tend to be more focused on a salesperson or an outgoing personality, if you haven't figured that out yet, as opposed to just kind of what do you have on paper. And I
Mm.
think what you got to remember this, what you have on paper has gotten you to this point. Now is a time to be a three-dimensional object and to talk and to act and all those things, because the two-dimensional object has already gotten us to here, right? So
It's your ticket to the game.
correct. Be three-dimensional now. Let me see who you are. Let me see how you interact with people, right? Let me see how you order. If we're sitting down and it's a lunch, let me see how you order, right? Let me see how you eat. If this is the first time of you, kind of eating and those things, and I realize that can be crazy, but guess what? You don't get to dictate those terms. If I've got just time for lunch, we're going to see how you eat, right? So all of those things kind of play into it, but I want to know that you've done a little bit of prepared, you have a background of what it is that we do. You're wanting to reach out and learn more about the role that you possibly can be, from myself telling you what's important to me, from the people that you can talk to gain a little bit more of understanding. And then you're kind of asking for what are the next steps. I mean, if you're not closing for the next step of a process in the hiring process, I feel like you've missed things. Whether you just want to sit in a lab and like fill pipettes all day, if that's your goal and your desire, so be it. But there's got to come an ask, right? We're here for something. I am looking for somebody to fill this role. I want you to step up and be like, hey, it's me, right? It's me, and here's why. Close it out. If there isn't anything and you're kind of like, hey, I've wrapped it up, and do you have any other questions for me? Is there something that you want to know more about? Who are some of the other people that you think I should talk to in this process? And again, I just want you to know that, obviously what's been on my resume is great, but I'm excited about this. I've done a couple things. Again, this is what I've got set up in order to potentially learn more about this. Is it okay if I contact you in the future with more questions? But you got to get something in order to get to the next step of what's going on, right? Close for something is kind of the saying in sales. Maybe
Hmm.
the final sale, but maybe it's the next meeting. Close for something.
Ask for something. We're going
Yep.
to open it up just now in a few minutes for questions. I'm sure our audience has them, and I would really encourage you to put your question in the chat, take yourself off mute when we're ready, and ask those questions. Now's your opportunity. You're not in an actual interview, but you have the opportunity to ask a hiring manager those tough questions. So, get courageous, take yourself off mute. If you haven't got your video on, put it on. I think Jeremy's made it clear he likes to see you and to meet you and to know who he's talking to. One last question here before we open it up.
Sure.
How important is, I guess, what are you looking for once the interview is concluded for follow-up? Is the follow-up thank you letter or email dead? Is it important to you? What are you expecting from a rock star candidate in terms of follow-up after that interview?
That's a great question. And again, I think that it's almost, does it buy you anything? I don't know that it buys you anything, but if you don't do it, I feel like it's going to be a little bit like, oh, I've never heard from them again. So it's almost like a box that needs to get checked. Um, but it's still an important one that needs to get checked. If there was an ask on your part, or maybe there wasn't, maybe you forgot to do it, maybe it's done in the email or a text or something, after the fact. um thank thank them for their time, right? I
Mm.
love watching the show Shark Tank, and it's always interesting to me when somebody just gets completely crushed. Their stuff is blown up, and their response is thank you for your feedback, right? It's
Yeah.
kind of like, man, it's tough to say that, but I appreciate that. And maybe you are not going to be the right fit for me of what's going on, and maybe I've expressed that to you. Maybe it's like, hey, help me get to where I want to go, right? Can you point me in a direction of another place that's there? So if there has been some sort of situation where I'm screening you and I say, hey, it'd be a good idea for you to kind of run along in the field, and maybe we haven't talked about that, I would definitely follow up and be like, who do I need to reach out to in order to set that up? Because I'm very interested in that, right?
Mm.
um, and you definitely want to make sure that you've got that opportunity kind of nailed down. Who do I need to call and talk to, right? So it's a great opportunity to really follow up on any sort of promise that was made, any sort of offer that was there, a potential next step, or if you forgot it, it's an opportunity to kind of go back and fix that step.
Okay. We're going to open it up for questions. So feel free to take yourself off mute at this point. Feel free to put your questions in the chat. You can raise your hand if you want me to try to call you out directly. Okay, we've got our first question from Ben. So Ben, go ahead, take yourself off mute, and the floor is yours.
Hi, thank you, Jenny, for hosting the meeting. I really appreciate it. And you as well, Jeremy, for taking the time to talk to us.
Sure.
So I'm a senior studying biomedical engineering at Tulane, and I'm interested in cardiovascular technologies, especially on the engineering side of things. I just finished building a prosthetic hand for my team design project, and I'm doing research on pulmonary surfactant and fluid dynamics. And I really just want to break into med tech, ideally in roles like R&D and product development. And like you said, I'm doing extracurricular activities like club basketball, and I'm in a music production group called the Waveform Producers. So I guess a question I would ask is, for someone passionate about medical devices and cardiovascular health, what would you say is the most important thing for me to focus on in my last year to be most competitive for these full-time roles?
It's a great question. And I think that, you know, the easiest thing for us to do is always rely on our strengths, right? But be honest with yourself as far as what are your weaknesses. You know, and I say that only because focusing on your weaknesses, maybe it's a fear of public speaking, whatever it could be. Maybe it's, I feel like I'm lacking in this phase of engineering or something that you feel like is going to be applicable to what's going on. But I think it's a good idea to intentionally put yourself in a position of growth and development. I was with a friend, dear friend of mine, and we were out camping, and he challenged me. He said, "Do you intentionally put yourself in challenging situations?" And I thought about it, and I said, at this point, I'm just trying to navigate the road of life between family and everything else, and I try to stay as comfortable as possible. But that actually was a spark for me to finish off my morning shower with a cold shower as long as I can possibly stand it. With the intentionality of I am choosing something difficult to do that I don't personally enjoy doing, right? So I would ask, your friends, your family, your professors, whatever, and something that you're saying like, hey, what do you guys think is potentially a weakness or something that I need to build out and develop so that I can kind of bring something out of it, right? And maybe you go a little deeper on some of these other things. You're doing club basketball right now. You leave Tulane, roll green tide, but you leave there, and what are you going to do that's kind of like the next thing? Have you prepared some sort of bridge, if you will, to your professional career and what you want to do, and have some sort of life outside of career? Again, all the things that you've built, I can barely put together a peanut butter and jelly sandwich. So hats off to you guys, but go through and do something that's beyond where it is, and take advantage beyond where it is, beyond where you're currently at. Continue to develop those points of weakness, develop those things, and then be very intentional. Ask Chat GPT, what it suggests, pulling from all those data points. I'm one data point, but find out where you should be applying, find out if there's any internships available, find out who are the leading manufacturers for the products that you're looking to design, and really pursue them and reach out to them and start connecting, right? Via LinkedIn. These are the people that you want to be with. Take advantage of every opportunity that's presented to you is my encouragement to you. Hope that answers your question.
Yeah, thank you so much. If you don't mind, could I just follow up with, I know you may not know much about this, but coming from a background that I have, like, what roles would you say within cardiovascular at Abbott would be a good fit to explore? Because I think I'd be looking for internships, considering I probably won't get a full-time job immediately after getting my undergrad degree.
Yeah. So some of the positions that I think, are good places to start are a little bit more in-house, right? if you say like, I like engineering, but I like, dealing with people or interacting with people, new people, more than I like kind of interacting with the people that I already know. You almost need to decide, do you want to be in something like human factors, where they're testing, or do you want to be, in upstream product development where they're kind of coming up with prototypes and those types of opportunities to maybe engage limited with customers. You're not having to be the one to develop that relationship. You're relying on somebody locally to kind of help introduce that relationship. But there's a lot of engineering processes that go on prior to getting these products to where we are. So again, you might transition out into the field later on, but I think you have to search yourself and identify, where do you want to be kind of in that medical device space? Do you want to be in product development? Do you want to be kind of in this human factors where they're seeing, do these products work the way that we intended them to be? Or do you want to be in medical devices where you're actually, working with patients and having that direct contact? Does that make sense?
Yeah, thank you.
Okay.
Wonderful. Thank you so much for your question. Alyssa, please go ahead and unmute yourself and go ahead and ask your question to Jeremy.
Hello, I'm a junior at Texas A&M studying biomedical engineering, and I'm also focused in cardiovascular devices. Um, my question is more so along the lines of how important is a portfolio at Texas A&M, because you don't really get the opportunity in outside of college to explore other options of engineering. I'm trying to broaden my experience as much as possible since biomedical engineering is pretty niche.
Yeah.
I've done mechanical experience, electrical, marketing, and then I'm doing cellular research this next semester. How important is it to show a portfolio to get you to the interview stage? Because that's my current problem.
Yeah, that's a great question. Again, I believe that they're almost like trophies in the case, right? Of things that you've accomplished. Um, I would put a lot of value in the fact that you've done those things, but as far as me seeing it and kind of understanding what it is, I'm not exactly sure, right? But I also, to me, that sounds very specific to more of a manufacturing, or kind of soldering wires together to come up with prototypes, more so than being kind of customer facing in what's going on. In more of the customer facing things that's going on, what that does to me is it literally will check a box that say, Alyssa is really, really smart, and she could actually, think on her feet and come up with, if I give you enough time, you're going to come up with this solution to the problem, right? So some of what we have to do is a little bit more, think on your feet, very quick, those types of things. So I think it really matters depending on which position you're going towards. If you're looking at doing something that's more manufacturing based, or, kind of upstream engineering, this is going to be a perfect opportunity for you to showcase that. And they're probably going to want to see that. For me, it's more customer facing. Like I said, I would literally go, perfect. How can you have a conversation with this physician and be able to articulate what this patient's disease state is, and how what you may have just done impacts it? Does that make sense?
Yes, thank you so much. It's funny to me. My first semester of my sophomore year, I was a team leader in an engineering organization, and we had to sell our product. And I went into that, nobody knew what our product was, and we ended up winning like $500 out of our organization. And people were constantly asking me, "Are you in marketing? Because you just sell this really well." And I was like, "I didn't know I had that skill set." But yeah, so I think that's also very important, because if I hadn't had that, we definitely would not have won because nobody knew us. Um,
Right. But see, that right there kind of in that highlights how important it is to be more than just one dimensional, right? Like, all of you that are, engineering majors, really, really smart, right? I imagine that all of you have roughly 70% of the same profile of what's going on. But if you've got other areas where you've started to branch out and build up your skill set of that, could be great. A good friend of mine says the market will always dictate what this will become, right? Same thing for you. If I bring you in, you might come on customer facing and realize that's not truly your cup of tea, and you may seek something in-house, right? So it kind of, you can vacillate between two different areas in what we do, but it's good to have that experience and kind of know, hey, I am or I am not interested in what that is.
Okay, awesome. Thank both of you for all of your very specific advice. I know a lot of us can probably relate that there's a lot of convoluting and broad advice out there, and it can feel like a black box problem to try and break into. So
Yep.
thank you for your time and your advice.
Thanks for your question. Gig 'em.
Kyle, go ahead and unmute yourself. The floor is yours.
Hi, Jenny. Hi, Jeremy. Thank you guys for hosting this. It really means a lot. It's actually really cool, Jeremy, to see another Division I student athlete kind of break into medical tech. You rarely see that. Like I go to UOP up in Stockton and I'm
Yeah.
on the swim team, so super, super cool. I just wanted to ask you if you have like a go-to framework or like mindset when you have to solve some complex problems at work and how you kind of deal with failure and learning from your mistakes and stuff like that.
Well, Kyle, congratulations to you. You're doing something that not a lot of students get an opportunity to do. Make the most of it because it it ends quickly. Um, I think one of the things that having been an athlete, my kids are heavily involved in athletics. I love the life lessons that it teaches, right? And I find that if you've learned those life lessons, it doesn't matter the arena that you're applying them in, they're the same life lessons, right? I tell my kids all the time, it's not about whatever sport you're playing, it's about the lessons you're learning to be able to apply them later. And I think the same for you. Oftentimes the hardest thing to do is the thing that you're supposed to do. When I face, failure or defeat, I allow myself a very short amount of time to deal with the emotions of what that is. I then transition over to creating a plan about how I'm going to deal with this. And then I start the action part of it. And it's amazing when you do that, you start to, it changes your mindset. You start to feel like you own it as opposed to it owning you, that setback, that defeat, whatever it may be. It's no different than, you said you were a swimmer, correct?
Yep. Yeah.
So you lose a race and you're like, man, that sucks. You're upset about it. You spend the day, the rest of the week, whatever it may be. But then you're like, what did I do wrong that I needed to do better in order to do it? Right? Maybe it was your start. Maybe it was your finish. Maybe it was your kick turn, whatever it may be. But then you're going to go, I got to work on that. Right? That's a weakness. I got to work on that. And then you're going to set up a plan in order to get better at that. And you're going to feel better going into your next race because you're like, hey, that was a weakness that I worked on and I'm going to get better at that. And I've prepared more for this next meet. I should have a better outcome than what's going on. So it's the same thing, same process. Sometimes we may lose a case to a competitor. Why did we lose it? The physician didn't understand our benefits, our features of our device. I got to make sure that I go back and make sure that they truly understand what those features are so that I can get the next one. How should I do that? Well, I'm going to set up an in-service in the office. I'm going to make sure that he understands this specific feature. And then I'm going to go ahead and deliver on that. And I'm going to stay on top of them and continue to remind them about how that's done. So same process, two different examples of how it's done, but you can see how, learning that at an early point in your athletic career will transition over to your professional career as well.
Yeah, for sure. Thank you. Yeah, it's really crazy how athletics and your professional life kind of relate. Like, I feel like I have such a stronger sense of time management and just having a process and goal-oriented mindset in my academic, professional, and athletic career. So thank you
Absolutely.
for that. Yeah, I really
Very well.
appreciate it. Yeah,
Yeah. Good luck.
thank you.
Go Tigers.
Robin, go ahead with your question.
This is something we touched on a little bit earlier, but I was wondering if we could talk a little bit more about your recommendations for doing research on a company before going into an interview, because I feel like in the past when I've done this, like I can, go through the website, I can maybe write down a couple of things that I learned, but what, I guess, from a hiring side, would you be looking for in what kinds of research I've done or what I know about the company further than just like the basic facts about the company?
Sure. Um, definitely trying to 360 the problem or the situation that you're trying to get involved with, right? Find somebody that has the same job title as what you're looking to do. Reach out to that person. If they don't respond to you, reach out to a couple more. Ask them, is there anybody that I could reach out to, regarding this? Do you know, this, do you know who this hiring manager is that's kind of flown this position? What can you say? Look to see, if you saw that there was something in cardiac rhythm management, and let's say it's a sales or a clinical specialist role, find somebody on LinkedIn with that clinical specialist role, contact them. Hey, I'm interviewing for this role over here, and they may be in a completely different market. I don't know what city you're in, but let's say you see that there's one in Los Angeles. The job's going to be ubiquitous across what's going on, right? But the more that you can kind of dig in and kind of scratch and get more perspective of what this job is, as opposed to just sitting down to a hiring manager and saying like, tell me, right? Um, so dig into it. Look to see if it's, something with a pacemaker. I would expect that you don't need to know the steps of the procedure, but I would expect that you would have seen a pacemaker implant online. Everything's online, right? You can see videos of anything. So go and find it. If you see that there's a specific product that's highlighted on our news briefs, or our recent topics, go on there and see what those products are and then pull it up. Can I see a implant of, X or Y, or can I see this technology being used in patient care? What are people saying about it? Do a little bit of research too about just the market in general that you're trying to get into. What are some of the factors that are making it difficult to find a job in MedTech, right? Do a little bit of the research on there so that when you're sitting down, as Jenny asked, what are some of the questions? You can say, hey, listen, I know that there's a lot of talk these days regarding tariffs. How do you project that to be a factor in your guys' business right now, but also in the next year or two? Do you see that playing a role? And if so, what? Right? Like if somebody asked me that, I don't even know if I'd be able to respond. So please don't ask me that. But I think that they're at least going to give you some sort of perspective and can at least speak to some of the conversations that they may have heard from the hospitals, how they're being asked to do more with less, right? So just trying to gather as much data as you possibly can. And if you do get somebody on LinkedIn that's going to respond to you, hey, what are the most challenging things that you deal with, right? Find those things and then bounce it off. You want to ask a question that shows you've done your homework, that shows you've done your research. So I would say dig into it in as many different ways as you possibly can. Is kind of the way I'll wrap all of my rambling up, but hopefully that answers your question.
Yes, that is super helpful. Thank you very much.
You're welcome. Good luck to you.
Thank
We've
you.
I'm so sorry. We've got two more questions, Jeremy, if you have the time. I do want to be respectful of your schedule as well.
Hey, happy to provide it, Jenny.
Awesome. Thank you. Okay, Kirsten, go on ahead.
Hi, I'm a senior at Texas A&M studying biomedical engineering, and I hope my question is simple. But it's basically how early is too early to apply for full-time roles after graduation? I know for my current internship, there was an application opening day, a deadline, and I knew what the start date was months ahead. So what does that look like going into a full-time position?
That's a great question. And see, I can tell that you're an engineer because you've thought of everything by asking that question. So we it's going to take some time. Any company that is fortunate enough to hire you, you'll see that it's going to take some time to get through their onboarding phase. That's going to be something where they're looking at it, make sure you don't have any issues background wise and whatnot that's going on. So I would say within 6 months, you should be reaching out and applying for some of these roles. I would say more like 4 months is probably going to be, you guys graduate in May. So as it's, turning into the calendar year of your graduation, you should definitely be reaching out and having some conversations and at least trying to make connections, right? At least trying to make connections with somebody to have conversations. Do you foresee yourself having openings in, wherever you're from, and if that's where you want to be, but do you foresee there being openings in this role? How early will you guys start to hire? Every company is going to have a little bit of difference. They may say, no, I need somebody right now. Or they may say, you know what, let's keep in contact because it's going to be some time from here. It's tough because I can't hire you until you actually graduate, right? But you also need it when you need that job as soon as you're graduating. So it's hard to pin down a specific time, but if you're reaching out to me earlier, I'm going to appreciate that. And you stay in contact more so than just all of a sudden like, hey, I'm I need a job in the next month. What do you have? Right. So I would say early and communicate often.
Thank you. I definitely taken the advice that I've heard from other people of just reaching out, like to some of the recent grads from my school who have the lower clinical specialist roles, just to see what their life is actually like in that role to be able to understand before I go into the application process. So thank you.
For sure. Absolutely. Good luck to you.
Thank you.
Drusty, go ahead with your question, please.
Thank you. Hi, my name's Drusty, and I'm a BME major at Georgia Tech. I had a question for after the interview process. If after the interview you don't end up getting the role, what is the best way to stay on the company's radar and to show constant interest in the role?
That's a great question. We, as I mentioned, we have recruiters that work in various, spaces, depending on, I believe ours are specific to cardiac rhythm management. But I would continue to try and locate who those people are online. And, we will kind of swap resumes and whatnot. I had the opportunity, was it maybe 2 years ago to go to do some interviewing at the SWE conference, Society of Women Engineers, because it was in Los Angeles. And it was a little overwhelming for me to see like the size of Abbott and all the different divisions that were there and the recruiting network that was going on, and the swapping of resumes and everything else. So if they are going to come to your school, connect in with them, and they will kind of start to profile you and say, hey, they've got this. If the hiring manager has looked for biomedical engineers or any sort of engineering that's there, they're going to be able to swap those resumes around. Career fairs are a great way to do it as well. Like I said, at SWE, you had hiring managers there from nutrition, diagnostics, cardiac rhythm management, some of these other things, but also understand that we, in some of these more customer facing roles and some of these more technical roles, aren't going to be making, hiring decisions that day. It's very rare that that happens, that we go into one of these, big conferences and just start hiring people. Maybe if I'm looking for somebody to be, a line engineer or something like that, I'll make those decisions, but I'm going to want to see how you fit in with the team, right? Before I start to do those things. If you are going to be in, let's say after college, you're going to stay in the Atlanta market. And I would start to connect into the market that's around there as far as the people from Abbott, and start to make those connections and those inroads with them so that you can start to ask them. Any sort of connection that you get that's internal is so valuable to have. So staying relevant in that local team is going to be a really fast way for them to identify a potential local need for you. Does that help?
Yes, thank you. Thank you for
You're
your
welcome.
advice.
Love to.
Everything was really informative, and I'm definitely going to be using some of the advice in the future. Thank
Awesome.
you.
Go Yellow Jackets.
Okay, I think we have time for one more. Sid, please go ahead and unmute yourself and ask Jeremy your question.
Hi, both you and Jenny have emphasized the importance of networking, so I was wondering like what the best way was to like get some names or emails.
Yeah, great question, right? That's always the golden thing. And please understand that, emails are just kind of one way to do it, but some of it's a little bit of, trial and error, right? My email is pretty simple, and most companies have a very similar format to what it is, but it's usually first name dot last name at whatever company you're working for. And if you see some of those things online, it's reasonable to believe, unless you've got somebody that, like, for instance, I'll use Jenny. Hers might be Jennifer, right, instead of Jenny. So you never know what that could be. But if it bounces back and you put in Jennifer, try Jenny, right? So there's not a real specific formula to do this, but if you get one email, you should be able to figure out pretty much everybody else's email and how it's constructed. Sometimes it might be first name, initial, and a last name, but these are all pretty simple to figure out.
Okay, thank you.
You're very welcome, Sid. Good luck to you.
let's wrap up from here. Thank you so much for everyone that's joined on the call today and for all the wonderful questions. If you didn't get a chance to ask a question or you think of something after we've concluded the webinar, feel free to email in and I'll try to provide that answer for you. You can use the support@mynavro.com email address. We do check that and we'll get back to you within 24 hours. Jeremy, thank you so much for your time today. I know how valuable it is. I know how many people beyond your team are depending on you in the very critical work that you do. So I appreciate it. And we thank you. And I hope that you do get to enjoy a little bit of the beauty of the location you find yourself in today and have safe travels when you head back to the mainland.
Yeah, thank you so much, Jenny. It's been a privilege to be on here. I think what you guys are doing at Navro is amazing, and it's definitely a site where when I'm looking for that profile, this is the place to go to look at it. So it's been great to be on the show, if you will, or the conversation, and look forward to helping you in the future any way that I can.
Thanks, Jeremy. The pleasure is all ours. We've really enjoyed having you.
All right, take care. Bye now.
Mahalo.
Mahalo.